Good evening. My name is Don Gardier, and today I will be presenting on a critical public health issue, which is prostate cancer vulnerability in the Eastern Caribbean among men aged 45 to 65, with a focus on the environmental and social determinants that contribute to this health disparity. Here is an overview of the topics I will be covering. I will start by introducing prostate cancer and why it's significant in this demographic. From there, I will focus on the epidemiology and the data. I will cover the key public health problems. I will cover the risk factors, the environmental factors. I will also touch base on factors like pesticide exposure, air pollution, and water insecurity. I will also examine the social determinants, barriers to early detection, and current screening practices. Finally, I will share the community engagement strategies and the prevention and mitigation plan. So let's begin. So what is prostate cancer? First of all, prostate cancer is defined as a disease in which abnormal cells in the prostate gland, which is a small organ located just below the bladder, begins to grow uncontrollably. The cancer begins with DNA changes in the prostate cell, which causes them to multiply faster than normal. So here you can see that depicted here in Figure 1, which is an anatomy of the male reproductive and urinary system, showing the uterus, the bladder, the prostate glands, the urethra, the penis, the testicle, and other organs. All of these organs are impacted by this disease. So the symptoms, some of the most common symptoms are difficulty starting or stopping urination, weak or interrupted urine flow, frequent urination, especially at night, pain or burning during urination, blood in the urine or semen, painful ejaculation, pain in the lower back, hips, or the pelvis. The treatment and the prognosis. So some of the most form of the diagnosis, first of all, is first is the specific antigen blood tests. Then you have the digital rectal exam, which is referred to as DRE. And here you're seeing two different forms here, as you see in figure 2, which is the transrectal biopsy also, which is another form of diagnosis, which is by a biopsy to confirm the cancer by examining the prostate tissue under a microscope. So what is done is an ultrasound probe is inserted into the rectum, as you can see here, the ultrasound probe, and then a needle is inserted here. You see the needle is inserted through the rectum in the prostate to remove the tissue from the prostate. Another, as I mentioned earlier, which was the DRE, there the doctor inserts a gloved, lubricated finger into the rectum and fills the rectum, anus, and prostate in males to check for anything that is abnormal. And so for the men in the Caribbean, that is a stigma. Just the idea of going to get examined in that way is a huge stigma in the Caribbean, and so that is one of the greatest, I believe, drawback to, I would say, the greatest cause of such a high prevalence of prostate cancer deaths in the Caribbean. Now, for the treatment we have the sorry. First, let's go over the prognosis. So, prostate cancer, it is often slow growing and highly treatable when it is detected early. However, there are some forms that are aggressive and they can spread quite quickly. So, the forms of treatment here we see it's surgery, radiation therapy, hormone therapy, chemotherapy, targeted therapy, and immunotherapy. So the surgery is done to remove the prostate gland, which may be an option if the cancer hasn't spread outside of the prostate. So that is a good option if the cancer hasn't the cancer cells are contained in the prostate. Then there's the radiation, which uses high energy to kill the cancer cells or to prevent them from growing. Then there's the hormone therapy, which it blocks the cancer cells from getting into the hormones they need to grow. It may include taking medicines or having surgery to remove the testicles. Then there is chemotherapy, which uses medicines to kill cancer cells and to slow the growth or to stop them from spreading. Then there is also the targeted therapy, which is done through by taking drugs for your mouth or injection or intravenously. And so then there's immunotherapy. This also it's less harmful to a healthy cell than radiation therapy or chemotherapy, and it's a treatment that is done to actually help the immune system to fight the cancer cells. So the statement of the problem. So the targeted problem, or the problem that I'm addressing, is prostate cancer, a major risk for men in the Eastern Caribbean. And so a lot of the men in the Eastern Caribbean, as a result of the the stigma, the low rate of them getting checked, we see there is a high incidence of stage 4 prostate cancer in the Caribbean, right? So the cancer in stage 4, as we mentioned, the cancer has spread to other parts of the body, the bones, or distant lymph nodes. So this group, which is men 45 to 65, they face a unique social, economic, and environmental challenges. And as a result, prostate cancer is the most common cancer among the men in the Caribbean. The region has the highest prostate cancer deaths rates globally, and it's been estimated that 50 out of every 100 men die from it, which is more than twice the rate seen in the US or even in the UK. Men aged 45 to 65 in Eastern Caribbean, as I mentioned, they are especially at risk. However, they face many barriers, which is including stigma around cancer, fear of diagnosis, the high cost, not enough healthcare specialists, and then, as I pointed out earlier, the late stage diagnosis is common. So in this image again, I'm showing an image of what it's like when the cancer cell has metastasized. So here is a profile of the target population. So again, the men aged 45 to 65 living in the Eastern Caribbean, and they are at a high risk for prostate cancer. And as a result, it's important to target the health. It's important for targeted health intervention. That's why one of the reasons why I've selected that population. And then it's the typical work. The men are typically their typical work are environmental exposures. Men in this group, they work outdoors or jobs like farming, fishing, tourism, or skilled trades. They are educated. A lot of them today are highly educated, and they have strong religious and community ties, and they have high technical and educational skills. The environmental context. A lot of the men in the Caribbean, they live in rural or coastal areas with heavy pesticide use, and many face water or food insecurities, right? So next, I will just give explain why I chose to focus on this demographic. So again, these men in the age 45 to 65, they they play a key role in society, right? Because they are responsible for supporting their families and their communities. They are not only workers, but their fathers, their uncles, their brothers, their mentors, their leaders in the community, their pastors, and they're often, as I mentioned, play a central role in the community, and play a central role in their families. They're at a higher risk, and there's a higher risk among them, and there's a lower detection rate, right? So because um, this group face a higher risk of developing prostate cancer because of the stigma, and a lot of them, because of the stigma, they do not go to the doctor, right? Then there is the late diagnosis which results from that. So many of them, when they do go to the doctor, it's usually towards the end stage. It's usually when they're so ill that they have no choice but to try to seek help. But usually when they do seek help, it's usually towards the end stage. So many of them, they are diagnosed late, which limits their treatment option, and it lowers, excuse me, their survival chances. Then there is the job-related health risk, and their work often exposes them to pesticides, to chemicals, to environmental pollutants that can increase cancer risk. And I will go more into details about all these points later on in this presentation, right? So the epidemiology and the data. So in this chart here, we see I'm showing some of the islands, which are Jamaica, Barbados, Trinidad, Antigua and Barbuda, the Bahamas, and the Caribbean as a whole, right? So this chart, it shows the prostate cancer incidence across the Caribbean nations, such as the islands I mentioned. But here you will notice that I only have some of the islands, and that is because of a lack of national screening guidelines. It is evident in the Caribbean, as there are no prevalent or incidence data reported for some of the islands, like Dominica, St. Vincent, and um, um, Grenada, right? The Here in the next chart, in this pie chart, we see the mortality rate of the prostate cancer within the Caribbean, and the mortality rate is per 100,000, right? So the mortality data, it also reveals a troubling trend in the Caribbean, because men are dying from prostate cancer at a significantly higher rate than their counterparts in the US or the UK. And by their counterparts, I am referring to African American males or African American descendant males in the US or the UK. Then in table 1, here we see the resource allocation within the Caribbean small island nations for the management of prostate cancer. So here you can see there is a very low percentage of urologists in the Caribbean, oncologists. A lot of them have option to CT imaging and chemotherapy. Um, There you see, for the screening, you see that the majority of them, there is either no screening, meaning that they do not get screened, or they're very op- opportunistic. Um, you know, opportunistic. They have the opportunity to do it, but some of them, they there is no opportunity, or they just don't do it, don't bother to get screened. Yeah. So here, this map now, it's an extension of table 1. So this map, it highlights some of the small islands facing this burden, right? So as I mentioned, some of the islands, you see some of the islands within, um, map of the Caribbean small islands. And here, many of the region, they lack resources to adequately manage the disease, pointing to a need for better health infrastructure and policy support in the Caribbean. So here, I would like to address um, some of the determinants of health, and also the related public health problem as a result. So multiple determinants impact these men's health. Biological factors such as um, ethnicity, behavioral issues like delayed screening, and social challenges such as stigma and economic hardship, environmental exposures, and geographical barriers, they all compound these risks, right? So next, I'd just like to show the modifiable risk factors and the non-modifiable risk factors. So prostate cancer risk factors can be modifiable, such as the diet and nutrition, physical inactivity, or non the the environmental exposure, so as the air pollution, unsafe water and food, socioeconomic, educational. So all of these things are risk factors that can be changed. These risk factors can be addressed, and there are things that can be done on an individual level, community level, and also governmental and health ministry level to mediate these factors. Then we have the non-modifiable risk factors, which are the age, family history, ethnicity, genetics, mutation, and the personal medical history. So a quick overview of the environmental factors. Um, here I'm exploring the environmental contributors more deeply. So here I have the pesticide exposure in the agriculture, um, the poor air quality near factories, unsafe drinking water, and chronic stress from socioeconomic pressures all alleviate cancer risk in this population. So, pesticide exposure on which is a common risk. Many men in the rural communities work in farming jobs where the pesticides are frequently sprayed on crops. Often they don't use safety gears or get proper training for handling um, you know these chemicals. And so why does that matter? It matters because research shows that being exposed to certain pesticides, like like um, DDT, which is used in the Caribbean farming, for example, in banana farming, for example, it is linked to a higher chances of getting prostate cancer. And then there's, of course, the lack of awareness, which is a lot of men might not realize how dangerous pesticides can be, which means that they may be putting themselves at risk without even knowing it, especially those working on farms or living close by. Then there's the air quality and the industrial pollution, right? Which is the city and factory pollution, and many people in the busy towns or near factories breathing air that has smoke, dust, or fumes. Then we have the health effects, which is like breathing polluted air can lead to inflammation and damage inside of the body. Then we have the bigger issue. It becomes a bigger issue each year because as the cities in the Caribbean get more crowded and traffic increases, the air pollution is becoming a more common serious problem for everyone, not just the men, but for everyone actually in the communities. Then we have the water and the food insecurities, which is another issue because the safe water um, is not guaranteed because of the old pipes, the water shortages, and um, damage from storm that not everyone at certain time of the year, especially during the hurricane season. There are times because as a result of the storm, they do not have clean and dependable drinking water. And then there's the difficulty with eating well, which is some families cannot afford it. They don't have easy access to healthy foods like fruits and vegetables, which are important for fighting diseases. Then we have the natural disaster, which impacts the hurricanes and floods, which are common in the Caribbean, and can cut off the water and food supplies for extended periods and make things get more difficult for them. Then finally, we have the chronic stress, which is, excuse me, a result of struggles with money. The people who have lower income are more likely to become more stressed. Then we have the constant stress. It takes a toll. So over time, this can weaken the immune system, and it can easily lead to diseases like cancer. And in this case, prostate cancer. Then we have the climate changes, which create more problem, and as a result of climate change, we have more frequent storms, flooding, and droughts, which create more health risks for the family and for the men in the community. So here, you know, understanding the barriers and improving, the prostate cancer prevention. So the cultural, you know, belief and stigma are major barriers. Men avoid screening due to fear, embarrassment, or mistrust in the healthcare system. And this perception they can lead to fewer early diagnosis and more advanced cases detection. So So here we have, the health belief why men don't get tested early. So we have the cultural belief, we have the fear and the cost, the access issues, we have the distrust in healthcare. Then we have the current screening practices and challenges in the Caribbean, which are low health literacy. Which is a lot of men, they don't know the symptoms of prostate cancer or why it's even important to get tested early. Then they have the trusted messengers. So the best way to get health information to the men is through people they trust, like their family, the church leaders, or even the local media, right? And then how to communicate. Information should be simple, it should be practical, and most of all, respectful. Then just continuation. Then we have also what is recommended, right? So the men over 45, if they have a higher risk, they should get prostate cancer screening, like the PSA blood test or a physical exam. Um, but not many get screened. Even though these tests are advised, not many of the men actually get screened because of things like cost, the stigma, and again, the low awareness. Then there is the lack of official programs. So most Caribbean countries, I should say, do not have an official screening program. So testing doesn't happen regularly, and the cancers, again, are often discovered late. So the ways to protect the men's health and to save their lives is regular screening will help, community health education, and then providing a support system. So I will just cover a little bit more about that later on in the presentation. Then we have the protective factors. So the protective factors I mentioned are the regular screening, the community-based health education, and the social support network. So before I get into the community engagement strategies and the prevention and mitigation plan, I just want to cover a little bit about, here is a SWOT analysis, and here we see the strengths, the opportunities, the weaknesses, and the threats, of prostate cancer, or, for men, I would say 45 to 65 in the Caribbean. So, what are the strengths? Some of the strengths are just their strong community connection, which is supported by the churches and local groups. Then we have a high level of technical and formal education, which makes it easier. For the opportunities, we work with trusted community leaders and survivors to expand the education and testing program, partnering with the churches, barbershops, and workplaces to help make testing more acceptable. And for the weaknesses, we have there's a high rate of late diagnosis, there's limited access to affordable screening and mistrust in medical systems and cultural barriers, and then insufficient resources for widespread screening. Then the threats, we have the cultural stigma around cancer and ideas of masculinity that discourage the discussion of prostate cancer. Then there is the lack of governmental support or there are unstable governments. There's limited financial resources and other health issues like infectious diseases or diabetes taking priority. So here I will be getting just briefly into some of the suggested action plans, which I will cover in the community engagement strategies and the prevention and mitigation plan. So for the community engagement strategies, community engagement, it is vital. So the effort should include cultural sensitive education, the use of local media, um, community meetings, which is, community engagement, um, and hearing testimonials. By sharing testimonials, encouraging, people who have survived this disease to share their testimonial stories. It could help to reduce the fear and open the lines of communication, right? And then there is the cultural humility training, which is very, very important. So training healthcare providers to culturally, in cultural humility can also help to improve the outreach and trust, and also to probably decrease some of the stigmas that are, you know, that are felt. Next, we have the prevention and the mitigation plan. So it must, prevention must address awareness, access, and reduce stigma. It should make screening easier to access, reduce the environmental and work-related risk, and so there we have, like the mobile clinics and health fairs can bring services to remote areas, educating farmers on safe chemical use and improving food and water security are essential steps towards long-term health improvement. And also, we must also improve the health education, training more specialists, creating national screening guidelines, and offering counseling can help, including families in education, and providing support groups improve both physical and emotional outcomes, right? So here, we can, support mental and emotional health, like peer groups and counseling services. So, in conclusion, um, prostate cancer, it remains a major threat for Eastern Caribbean men aged 45 to 65. A holistic approach combining environmental awareness, early detection, and culturally tailored outreach, it is essential. And I believe we must act collectively to reduce mortality and improve health equity. So, these are. Thank you so much for taking the time to listen to this presentation. And on this slide, I'm just showing some of my references. These are the key sources that I used in this for this presentation, including regional cancer registries, public health agencies, and peer-reviewed studies. So, thank you very much. And here's also a QR code. By scanning this QR code, you'll also get an online version of this presentation. Thank you.